Adopting a child with a congenital heart defect is a rewarding experience. With proper care, these children can go on to have long and healthy lives with a near normal life expectancy. Congenital heart defects are the most common type of major birth defect. They affect 8 out of every 1,000 newborns. Each year, more than 35,000 babies in the United States and over 1 million babies worldwide are born with congenital heart defects. Congenital heart defects are problems with the heart structure that are present at birth. These defects can involve the interior walls of the heart, the valves inside the heart, the arteries and veins that carry blood to the heart or the body. A baby's heart begins to develop shortly after conception. During development, structural defects can occur. These defects can involve the walls of the heart, the valves of the heart, and the arteries and veins near the heart. Congenital heart defects can disrupt the normal flow of blood through the heart. The blood flow can slow down, go in the wrong direction or to the wrong place, be blocked completely. There are many types of congenital heart defects. They range from simple defects with no symptoms to complex defects with severe, life-threatening symptoms. Many congenital heart defects cause subtle signs and symptoms. Initially, a doctor may not even detect signs of a heart defect during a physical exam. Severe defects can cause signs and symptoms including rapid breathing, cyanosis, which is a bluish tint to the skin, lips, and fingernails, fatigue, poor blood circulation. Congenital heart defects do not cause chest pain or other painful symptoms. Heart defects can cause heart murmurs, which are extra or unusual sounds heard during a heartbeat. Doctors can hear heart murmurs using a stethoscope. However, not all murmurs are signs of congenital heart defects. Many healthy children have heart murmurs. Normal growth and development depend on a normal workload for the heart and normal flow of oxygen-rich blood to all parts of the body. Babies who have congenital heart defects may have cyanosis and tire easily while feeding. As a result, they may not gain weight or grow as they should. Older children who have congenital heart defects may get tired easily or short of breath during physical activity. Many types of congenital heart defects cause the heart to work harder than it should. With severe defects, this can lead to heart failure. Heart failure is a condition in which the heart cannot pump enough blood to meet the body's needs. Symptoms of heart failure include shortness of breath or trouble breathing, fatigue with physical activity, buildup of blood and fluid in the lungs, swelling in the ankles, feet, legs, abdomen, and veins in the neck. Children with subtle congenital heart defects often do not need treatment, but do require regular follow-up by a healthcare provider. Children with symptomatic congenital heart defects do need treatment, which may include catheter procedures or surgery. Catheter procedures are much easier on patients than surgery. They involve only a needle puncture in the skin where the catheter, a thin, flexible tube, is inserted into a vein or an artery. Sometimes doctors combine catheter and surgical procedures to repair complex heart defects, which may involve several kinds of defects. The treatment your child receives depends on the type and severity of his or her heart defect. Other factors may include your child's age, size, and general health. Some children who have complex congenital heart defects may need several catheter or surgical procedures over a period of years, or they may need to take medicines for years. Doctors don't have to surgically open the chest or operate directly on the heart to repair the defect, which makes recovery easier and quicker. The use of catheter procedures has increased a lot in the past 20 years. They have become the preferred way to repair many simple heart defects, such as atrial septal defect, or ASD, and pulmonary valve stenosis. For ASD repair, the doctor inserts a catheter into a vein in the groin. He or she threads the tube into the heart's septum, A device made up of two small discs, or an umbrella-like device, is attached to the catheter. When the catheter reaches the septum, the device is pushed out of the catheter. The device is placed so that it plugs the hole between the atria. It's secured in place, and the catheter is withdrawn from the body. Within 6 months, normal tissue grows in and over the device. The closure device does not need to be replaced as the child grows. For pulmonary valve stenosis, the doctor inserts a catheter into a vein and threads it to the heart's pulmonary valve. A tiny balloon at the end of the catheter is quickly inflated to push apart the leaflets or doors of the valve. Then, the balloon is deflated and the catheter and balloon are withdrawn. This procedure can be used to repair any narrowed valve in the heart. To help guide the catheter, doctors often use echocardiography, transesophageal echo, or TEE, and coronary angiography. Transesophageal echo, or TEE, is a special type of echo that takes pictures of the heart through the esophagus. The esophagus is the passage leading from the mouth to the stomach. Doctors also use TEE to examine complex heart defects. A child may need open heart surgery if his or her heart defect cannot be fixed using a catheter procedure. Sometimes one surgery can repair the defect completely. If that is not possible, the child may need more surgeries over months or years to fix the problem. Cardiac surgeons may use open heart surgery to close holes in the heart with stitches or a patch, repair or replace heart valves, widen arteries or openings to heart valves, repair complex defects such as problems with the location of blood vessels near the heart or how they are formed. Rarely, babies are born with multiple defects that are too complex to repair. These babies may need heart transplants and are referred to regional centers that specialize in this type of operation. Based on the severity and complexity of the child's heart disease, families may be referred to regional or national pediatric cardiac centers that specialize in the level of care required. Insurance coverage may be difficult to obtain for a person with a congenital heart defect, as it is considered a pre-existing condition. However, families may be able to receive coverage through group plans provided by employers. Otherwise, families may have to buy insurance through high-risk pools. Such plans are more expensive, but will generally cover ongoing treatment for serious medical conditions. Many of these children need only occasional checkups with a cardiologist as they grow up and go through adult life. Children who have complex heart defects need long-term care from trained specialists. These include primary care physicians and pediatric cardiologists whom your child will visit periodically. This will help them stay as healthy as possible and maintain a good quality of life. Ongoing medical care is important for your child's health. This includes having checkups with your child's heart specialist as directed, seeing your child's pediatrician or family doctor for routine exams, taking medicines as prescribed. Children who have severe heart defects may be at a slightly increased risk for infective endocarditis, or IE. IE is a serious infection of the inner lining of the heart chambers and valves. Your child's doctor or dentist may give your child antibiotics before some medical or dental procedures, such as surgery or dental cleanings, that can allow bacteria into the bloodstream. Your child's doctor will tell you whether your child needs antibiotics before such procedures. To reduce the risk of IE, gently brush your young child's teeth every day as soon as they begin to come in. As your child gets older, make sure he or she brushes every day and sees a dentist regularly. Talk with your child's doctor and dentist about how to keep your child's mouth and teeth healthy. As children who have heart defects grow up and become teens, they should learn how their hearts differ from normal hearts. They should also know what kind of defect they have, how it was treated, and what kind of care is still needed. They should be able to recognize signs and symptoms and know how to respond. Work with your child's healthcare providers to compile a packet of medical records and information that covers all aspects of your child's heart defect, including diagnosis, procedures or surgeries, prescribed medicines, recommendations about medical follow-up and how to prevent complications, health insurance. Some babies and children who have congenital heart defects do not grow and develop as fast as other children. If your child's heart has to pump harder than normal because of a heart defect, he or she may tire quickly while feeding. As a result, your child may not be able to eat enough. Poor feeding may cause your child to be smaller and thinner than other children. Your child may also start certain activities, such as rolling over, sitting, and walking, later than other children. After treatments and surgery, growth and development often improve. To help your baby get enough calories, ask his or her doctor about the best feeding schedule. Also, ask whether your baby needs any nutritional supplements. Make sure your child has nutritious meals and snacks as he or she grows. This will help with growth and development. Children and teens that have a serious heart condition may have difficulty dealing with their emotions. For example, they may feel isolated if they have to be repeatedly in the hospital for multiple cardiac procedures and care. Some may feel sad or frustrated with their body image and their inability to be a normal kid. Sometimes brothers or sisters are jealous of a child who needs a lot of attention for medical problems. Monitoring your child's emotional health is an important part of their cardiac care. Comer Children's Hospital offers a support group called Mended Little Hearts for parents of children with CHD. They also have peer groups for patients and their siblings who have been affected by pediatric heart disease and CHD. Physical activity helps children strengthen their muscles and stay healthy. However, each child is unique, and the amount of physical activity that is appropriate may vary. Ask your child's doctor how much and what kinds of physical activity are best for your child. Some children and teens that have congenital heart defects may need to limit the amount or type of activity they do. Remember to ask the doctor for a note that describes any limits on your child's physical activities. Schools and other groups may need this information. The outlook for children who have congenital heart defects is much better today than in the past. Advances in testing and treatment allow most of these children to survive to adulthood. They're able to live active, productive lives. Individuals with less severe defects may not experience symptoms as they age. Others experience varying levels of symptoms that may increase over time, depending on the type and severity of the defect. Many adults with CHD continue receiving periodic care from both a cardiologist and primary care physician as they age. Some individuals may also need to take medications throughout their lifetime. Low to moderate intensity exercise is safe for most adults with CHD, but doctors may recommend avoiding strenuous activity. Women with congenital heart defects need to consult with their cardiologist and a gynecologist before using birth control. Some forms, such as the pill, may not be best for people with CHD because they increase the chance of blood clots. While many women with CHD are able to safely have children, some experience complications. Cardiologists can assess risks associated with pregnancy based on the individual's medical condition prior to pregnancy. University of Chicago Adoption Center, or UCAC, partners with families to provide compassionate, state-of-the-art care to children with congenital heart disease. UCAC and our associated pediatric cardiologists can assist with both pre-adoption and post-adoption evaluations and assessment, and even provide in-country cardiac advice when necessary. Our 5-visit post-adoption evaluation helps families welcome a new child into their home while synthesizing disease-specific information and integrating the care of this child into normal family life. The post-adoption evaluation includes both medical and developmental and behavioral care. UCAC is part of Comer Children's Hospital, with access to the highest quality pediatric cardiology and surgical subspecialty care. UCAC allows families to access internationally recognized experts who have pioneered many of the latest techniques in pediatric and congenital heart care. These physicians are changing the way pediatric cardiac care is delivered, using new treatment methods that offer several advantages, such as reduced hospital stay, faster recovery, and less pain and scarring. Patients from around the world travel to the University of Chicago to receive care from our congenital heart disease experts. After the Adoption Center's 5 adoption visits, your family may choose to continue your child's care with our team or may choose to transition to a local community provider. Families who move on to a local community provider will receive a transitioning packet for the pediatrician, giving a background to your family's story. If needed, the Adoption Center team is able to provide long-term care. Whichever path your family takes, know that you can always come home to Comer.